Why does the United States pay so much for healthcare and get so little health? One of the reasons is the way we pay for healthcare in this country is broken, and the fee-for-service system, where you only get paid if you do something to someone as a doctor, incentivizes expensive procedures even when they're not necessary. It creates a tug-of-war between insurers and clinicians, where the clinicians want to do something, the insurers are hiring people to try to tell them no, the doctors are complaining, which is very inefficient. And it actually rewards healthcare systems when their population is sicker, rather than rewarding them when their population is healthier. It penalizes healthcare systems in areas where people are, it particularly penalizes investments that the healthcare system might make to improve the health of the population. So the idea in health is to pay differently. And accountable care organizations are one way for that to execute that vision. What do they do to save money? What is the actual, you look under the hood for an accountable care organization, what's there? In my mind, the most important thing that they can do is change how care is delivered. They can say, we're not paid now by the heart attack and the stroke and the heart operation. We actually have a chance to do things differently, to invest in prevention, different kinds of things that we'll be talking about, and still see the benefits. In most of healthcare, if you do something to keep someone from having an expensive admission, you're losing the money and someone else is saving it. But when you have an accountable care organization, you keep the money. It's an incentive to change the way care is delivered. So that's just a bit of background, and now I'll switch to the Vermont model. What is it? It is basically an agreement between the state and the federal government to control costs and improve care by switching to, by establishing a statewide accountable care organization, which we know now is OneCare, and having patients participate in it so that they get enough of the volume, you get that multi-payer involvement, it can actually transform care. That's the concept. It includes a cap of the amount of money that can be spent on healthcare in the state of Vermont, which was the second statewide cap after Maryland. But it has other goals, including improved health and improved quality of care. In many ways, it's a more sophisticated approach than Maryland. It's a single accountable care organization for Medicare, Medicaid, and private insurers. So it's really trying to create that not just 10 patients, but get to enough patients that suddenly the clinical system can say it's in our interest to do things fundamentally differently. How do you think about the results for a system like this? I think you have to think big picture, process and outcomes. Process, to me, is are things being done differently? And then outcomes. What do you see on quality? What do you see on costs? And what do you see on health? You want to see overall health improvements too. For process, I'm impressed that there are a lot of different process innovations happening in Vermont, from telehealth to care models that really focus on children with developmental issues, the use of innovative technology. And the biggest one has been an investment in care coordination, with a 6-fold increase in the number of patients who are actively managed, meaning they have somebody who's looking out for them. To really see an enormous increase in care management is a good process outcome. Quality, there are a number of specific measures that are very promising in this. Timely care, good communication, good coordination, you score very well. High rates of follow-up post-discharge, primary care visits at high risk, high rates, and better developmental screening in pediatrics were all particularly good. What about costs? So there are a couple ways to think about costs. One way to think about costs is, well, what did you negotiate and what wound up happening? And so you heard in Medicare, or you may be aware, there was a negotiation and there was shared savings for the ACO, so that you beat the cost estimate. For private insurance, I think they negotiated and the ACO had to pay a little bit of money back. That's how it's supposed to work. The people are at risk. But the best study of this was done in Medicaid. And this was an independent research group. It was published in a peer-reviewed journal. And it actually looked at Medicaid accountable care organizations in 4 states, Vermont just being one of them. Vermont was the only one that really showed significant benefit. The only state. in this independent evaluation, about $39 per person per month compared to this comparison group, and fewer hospitalizations versus the comparison group. The other states didn't show that. And when they asked why Vermont, they dug into it. I would encourage you to read the paper. You see at the top, Vermont had the most promising results. Vermont aligned its Medicaid ACO design with Medicare and commercial ACOs in the state. What has made Vermont successful to date, in part, I believe, is the alignment that I was talking about before and that you see up here, that it's not just Medicaid off on its own trying to be the 10%, saving money, but Medicaid working hand in hand with other payers to get a care transformation that keeps people healthier and makes healthcare more organized for them. And then you can start to see that in some of the things that OneCare puts forward. In Berlin, you see patients with diabetes actually getting their sugar measured, the appropriate way much more frequently. In Brattleboro, inpatient admissions with high-risk Medicare beneficiaries are going down as the number of people getting care coordination goes up. These are the kinds of things that you want to see, that you're doing something and you're getting a result for it. To me, it is a positive early sign. It is not mission accomplished. I don't think there's anyone who would say it's mission accomplished, but a very positive early sign. Now, I just want to mention overall population health. The Vermont model is the only one in the country that started out and said, we want to see overall health in the state of Vermont improve as a result of this. It's very ambitious. And they particularly called out drug overdose and suicide, where Vermont is in the 19th to 21st, so on the high end, but not the tippy top of the country. So my conclusions: Vermont, in my opinion, is really at the forefront of the country in paying differently for healthcare in order to achieve better health, lower costs. The early results are solid, in my opinion, with room for improvement, and major change you'll see with time as systems really can transform and you get the scale you need. I think that success also requires the commitment and engagement of a broad set of public and private partners. You have a platform in Vermont for that. It doesn't guarantee results, but it gives you a chance that other states do not have to bring the various resources in healthcare and wind up getting a change that really is good for both costs and health. So I think that it's an interesting way to think about, and I haven't thought about it quite that way before, how being multi-payer like you are in Vermont not only gets you those results that only happen in Vermont, but gives you a lot of promise moving forward.